this down so don't be all echoey. Oh, wait, it's live. We're live. Almost did it. Almost had it on time that time. Let's see here. Who's giving a couple minutes for somebody to get in here? We're gonna get started here in a few minutes. You share this live. If you're joining me now, let's share this live. Let's see here. I'm going to share this over here. Create a post. All right. I'm giving a minute here for somebody to get in here. See if we get somebody to come in. I'm gonna share this to this button over here, and to this one over here. All right, and I'm gonna put it down here, see what happens. And I'll even put it over here. All right, okay, let's see what's going on here. Let's see who shows up here, if anybody comes in. All right, great morning. It's a Saturday morning. Looks like it's partly cloudy outside. I'm not even a weatherman, I'm giving weather every morning. All right, wow. Happy Saturday, everybody. Happy Saturday. And to my Muslim brothers, Ramadan Kareem. Wow, we got a pretty serious topic today. I've been advertising this all week. We've been talking about, people have been asking questions. We have with us Dr. Suzie Noronha. She's the director of pediatrics of a sickle cell program at Golisano's Children's Hospital. She's going to sit down. She's going to talk with us today about sickle cell and a whole bunch of other things, and a few things that's going on with the American Red Cross and part of their sickle cell initiative. So it's a big thing going on. I think it's important for us here in Wayne County. And before I turn it over to Suzie, I want to just let everybody know why I think this is important. I believe that there's a forgotten element of children and people in our community that we got to be aware of, especially out here in Wayne County and places like us, where the minority population is so small. When you have a really small population of Black and brown people, it's easy to forget about the things that can affect them. Just because of certain genetical things, nothing to do with any conspiracy theory or anything like that, but it's just some genetic things that go on with people that if you don't really have that high number, it can slip under the rug. But when we stop and look at it, for those of us who are in interracial relationships where we have children where they're part white, part Black, or part whatever, and part African American, there are certain things that we got to consider when we look at what's going on with our children. We think about health. So because of that, I didn't know anything about sickle cell. I've heard of it our whole life. I still don't know much about it. But what I wanted to do is give us all opportunity to learn together. So, y'all know how I like to do. If I'm gonna learn it, why not share it with a bunch of other people that y'all learn it when I'm learning? Because I don't know everything. So with that being said, I am going to turn it over to Dr. Suzie Noronha from Golisano's Children's Hospital to take over, and then we'll ask some questions later. All right. It's all yours, Suzie. I'm gonna shut my mouth.
No, I want to hear your questions and your comments, but thank you so much for inviting me onto your program, because I think there are a lot of things that people don't know about sickle cell disease, and sickle cell disease is probably, affecting people around them, people they work with, they go to school with, the people they love, and they don't even realize it. And so I really like this opportunity to share what I know and hopefully have a great conversation with you and your viewers. So I have a hopefully interesting presentation that will sort of generate questions. And let me know, do you see my slides? Perfect. And then, this is really meant to be interactive. So if you have questions, James, or if your viewers have questions, I'll definitely kind of stop and talk about them too. So.
Right. So if you have questions, put in the chat on Facebook. Put your chats and questions in the chat.
Mm-hmm. Exactly. So there is so much that we know and so much that we still need to learn more about. So this is definitely not everything that is known about sickle cell, but I think it's a good background to start the conversation. And I'm going to talk a little bit about trait too, because there are a lot of people around who have trait, and they got to know what we know about it so far. So let me advance my slide. So hopefully from this talk, you'll have a better understanding of where sickle cell disease came from, know the difference between trait and disease, understand a little bit more about what sort of things can happen to kids and adults with sickle cell. Transfusions can be life-saving, and I want to talk a little bit about why that is the case for people with sickle cell, and also why it's so important to have transfusions that are donated from diverse groups of people and people of color. So some people may know this, some people may not. So sickle cell disease is most common in areas around the equator, and that correlates with areas that had high and still have high rates of malaria infection. Malaria is carried by mosquitoes, which are definitely not as cute as this picture that I put up here. And malaria causes a lot of death. But it turns out that people with sickle cell trait, so one copy of the mutation that leads to sickle cell, actually were resistant to malaria. And that is true for other mutations that affect hemoglobin, and I'll talk about hemoglobin in a little bit. And so because those people survived malaria infection, they survived to have children, to carry on that mutation through the generations. And so we actually find the sickle mutation predominantly in people of African descent, but we also see sickle cell in the Mediterranean, in areas of South Asia, and in people of Hispanic descent. So while it predominantly affects Black Americans and people from Africa, it actually can be seen in a lot of different parts of the world. So I kind of alluded to the fact that most people in the world with sickle cell are found in sub-Saharan Africa. So globally, about 200,000 babies are born every year worldwide, and the vast majority of them are in sub-Saharan Africa. And in the United States, we estimate about 2,000 babies are born every year with sickle cell disease. And so depending on what report you read, that suggests about 70,000 to 140,000 Americans with sickle cell disease that we know of. So I wanted to kind of go back a little bit and talk about trait versus disease, and what does that mean? So we probably, all learned a little bit about genetics in school. Sickle cell disease happens when you have two copies of a mutation. And so that happens when you have a parent who has one copy, another parent who has one copy, and then that child inherits both of the mutated copies of that gene. When you've inherited one mutation from a parent and then the normal gene from the other parent, then you become a carrier yourself and you have trait. And then there's also a chance that the child will inherit a normal gene from one parent, a normal gene from the other parent, and not have trait at all. So that's sort of a very general explanation of the inheritance of a disorder like sickle cell, that you need two abnormal genes to have that disease. Yes, James.
So what you're saying is two people can have the trait, and that doesn't mean necessarily that their child is gonna have it also. It could be, they could have one. Let's say they have two children. One could have it, and the other one might not have it.
Exactly. So it's all up to chance, because it's random what copy gets passed down to each child. So it may be, a family will be completely, I would say, just by random chance, like they may have 4 kids and all 4 kids will have inherited the normal gene. And that's just, probability. Or, they may have 4 kids and all 4 kids inherit both mutations from both parents, in which case then all of those kids have sickle cell. So there's no way of predicting.
Is this something that if a parent finds out that they have, or if a person find out they have, that they're typically educated on these types of this type of situation that can occur? Because I can see, I mean, I can see being something really seriously on the psyche of a child where a bunch of other siblings don't have it, and you do.
Yes, yeah. So, you know, every baby in this country has like a heel stick blood sample that it's called the newborn screen. And that is drawn, you know, about like 2 or 3 days of life. And on that blood sample, you can actually detect disorders like sickle cell. And that is something that you really need to know about, because there are things you have to do to protect the baby as they grow up. And there are other disorders that you can detect early on from that blood spot. But you can also detect sickle cell trait. So actually every parent is informed if their baby has sickle cell trait. And then I, in my clinic, meet with families to explain what sickle cell trait means, and the potential for, if they have a partner when they grow up with sickle cell trait, you could ultimately have a baby with sickle cell disease. But I meet these families when the baby's like, a week old, and will they remember to tell their child when the child is like 25? And that's not something I can always ensure. So that sometimes people forget that they have sickle cell trait, even if their parents knew.
Oh, wow. So I think it's something we should get checked up on quite at least once in your life as you get up in age, to remember. Huh.
I think, and I think there is also testing, like prenatal testing, like when you're going to have a child. I think OBs will test for sickle cell trait and some other things,
Okay.
and their partner. But I don't know if that happens all the time.
Okay. Thank you. Yeah, you answered it very well. Thank you.
Okay. All right. So I wanted to kind of just go back to why am I talking about sickle cell disease, and what does it affect? Like, what is exactly the problem? And what is this gene that I'm referring to? So the gene I'm talking about is something called beta globin gene. And beta globin gene has the instructions to make the beta globin protein, or beta globin chain. And the beta globin chain, 2 of them, join up with 2 other chains that are called alpha globin chains to form a molecule that's called hemoglobin. Hemoglobin, 4 parts, so 2 alpha globin, 2 beta globin. And this molecule called hemoglobin is inside red blood cells. And this is the molecule that carries oxygen. It picks up oxygen and carries it through the body and delivers oxygen to the muscles, to other organs that need it. And then as the red blood cell circulates back, ultimately to the lungs, it picks up oxygen again and then carries it like a train to all of the organs that need it. And so when we have a problem like sickle cell that affects the beta globin gene, it ultimately affects the function of this hemoglobin and basically the function of the red blood cell. So that is the heart of what I'm talking about. And hemoglobin, I don't know if people look at their labs, like when their doctor orders their labs. So hemoglobin is what tells you whether you're anemic or not. So if your hemoglobin's low, that means you're anemic. And anemia can be due to a lot of things, but we're talking about anemia that's due to sickle cell. So people with sickle cell have low hemoglobin, and I'll explain a little bit more why. And so they are anemic. So hopefully that kind of explains some things.
So I may slaughter the word. I mean, everybody knows I'm good at doing that. But hemoglobin, that's
perfect.
Oh, hemoglobin. Oh, good, good. I said right the first time. Oh,
Yeah.
so that, but I can get on my like for me, I use the My Chart app.
Mm-hmm.
So I can get on the My Chart, and I can, like, I just had blood work done not too long ago, and I can
Mm-hmm.
go and I can look up on My Chart this hemoglobin, and then if it's going to tell me what's the, it always tells me what the recommended, what it should be, and all that kind of stuff, what's high, what's low, and the range. So if I'm
Exactly.
on the low side, I should start talking to my doctor about it, or if my doctor sees it, he should start talking to me.
Exactly, exactly. Because there are lots of reasons for anemia. And if you were not anemic to begin with, and all of a sudden you are, and you're of a certain age, then they got to look at, well, are you losing blood somewhere? Like, are you actually losing blood through your gut? And is that something that needs to be investigated? And then in like teenage girls, if they're having, I'm talking about gory details here, if they're having heavy periods, they can lose blood in that way and become anemic. And then it's got to be addressed.
Okay. So there's a lot of signs. There's a lot of signs that let people know that there's something that's going on and that this needs to be looked at. Okay, thank
Exactly.
you.
Yeah, absolutely. All right. So we'll come back to the red blood cell and what exactly happens to the red blood cell and sickle cell. But I just wanted to kind of touch on trait. So for a long time, people with trait have been told that it should be totally fine, but they could have a child with sickle cell disease if they have a partner who also has trait. But as we learn more about people with trait, we realize that there's some things that they need to watch out for. So there have been cases of people with trait who go into, high level athletics, like in the NCAA, or, join the military and get into boot camp. And when they undergo these really intense physical activities, there have been cases of sudden muscle breakdown, kidney injury, and unfortunately, rarely, but there have been cases of sudden death. So there's something about sickle cell trait when you put people in conditions of extreme physical activity, it can potentially lead to this problem unless you know it, and then make sure that those individuals are well hydrated, have an opportunity to rest, and catch it early. Yes, James. Oh, you're muted.
I was muted, y'all. I usually don't forget that. But I know you just discussed this already, talking about the some of the signs. But someone just asked in the chat, if a girl is losing a lot of blood during menstruation, is that a sign to be concerned?
So if it is heavier than you expect, and this happens, on a regular basis, you should talk to your child's doctor about screening their hemoglobin and making sure they have not developed anemia. There may be symptoms that can tell you whether it's happening, like when you're really anemic, you can get real tired and real pale. And so that would be something to follow up on with the doctor.
Okay, thank you. I hope that answers your question, Joanne.
Mm-hmm. So under these conditions, it's real important to make sure that people with sickle cell trait are adequately hydrating and getting rest when they need it. Doesn't mean they can't go, into the NCAA or the military, but they just need, some more consideration. And then there's more data that people with trait may be at risk for chronic kidney disease when they are older. We don't know enough about it, but I think it's important to raise awareness. So that way, if there's, issues with like blood pressure, or you're getting your blood checked and your kidney function just doesn't look right, and you have sickle cell trait, the two may be connected, and you need to pay attention to that. Yes, sir. I think you're muted again.
Yeah, I'm trying to mute right now. I have in the in the chat, Rachel has mentioned that said that when she was anemic when she was pregnant, and she had to watch it closely. So is this something during pregnancy that you can go in and out of also, that you got to be careful of?
So anemia is somewhat common in pregnancy for a few reasons. So you kind of put on a lot of water weight, as those of us who've been pregnant remember. And that can actually kind of dilute out your hemoglobin. And so it does make you a little anemic. The other thing is the baby, the baby takes, you're feeding the baby. And so the baby takes nutrition from you. And one of those nutrients is iron. And if you're not getting enough iron because you're not taking your prenatal vitamins like you should, or you're not having a good diet, then you can become anemic, because the baby will keep taking iron, because that's what they're kind of designed to do. So doctors do pay attention to that in pregnant women.
Yeah, and Rachel just said, I have low iron also. Doesn't that affect it also? So you answered her question at the same time. Mm-hmm. And Joanne also asks up, this person is anemic during menstruation. They have been tested. Is that a concern for sickle cell?
It should not be, because sickle cell is a lifelong condition that we actually diagnose right when people are born. And that started happening, I think, in the 1980s. So if the person gets anemic with menstruation, and their menstruation is too heavy, then it's most likely iron deficiency that is leading to that anemia.
Iron. Iron. That's I remember that was one of the concerns. That was one of the things we had to watch with our daughter. One of my daughters was iron.
Exactly.
Yeah, she was cold a lot, always cold.
Mm-hmm, mm-hmm. Yeah, for some reason, anemia can lead to people feeling cold. And there's probably a lot of different mechanisms why that's the case, but that could be a symptom.
Okay, great. Thank you.
Yeah, absolutely. And one final thing about trait is that there could be an increased risk of abnormal clots developing if you have trait. But again, we don't know enough. So I really think that more research is needed to really make sure we're not missing anything. Okay, all right, great. So let's move on to sickle cell disease. So remember, you have sickle cell disease if you have 2 copies of an abnormal gene. So if you have 2 copies of the sickle mutation, then that's the type of sickle cell that's called SS. But it turns out you can have other mutations affecting that beta globin gene. And when you combine a sickle mutation with another type of mutation, and we kind of have funny names for those mutations, like one of the names is hemoglobin C or beta thalassemia, those can also form different types of sickle cell disease. Yes, James.
I'm sorry, I got to put my hand down. I didn't mean to leave my hand up.
Okay.
I got to put my hand down. I got my hand up, y'all. She see my hand raised. She think I keep that up.
Look, I want to answer your questions. So
I don't put my hand down. I don't mean to interrupt. Continue on.
No, that's fine. This is a conversation. So,
okay.
So there are different types of sickle cell disease, and I try to educate my families on what type their child has, because there are different things that we've got to watch out for depending on the type of sickle cell you have. And when people have sickle cell disease, and when we look at their blood under the microscope, they've got a bunch of normal looking red blood cells. It kind of looks like this donut type shape. And then those are surrounded by other cells like white blood cells and platelets. But under certain circumstances, these donut-shaped red blood cells change shape because of that abnormal hemoglobin, and it forms this C shape. And, people thought that it looked like a farming implement called a sickle, and that's why they call it sickle cell. And so on the blood smear of patients with sickle cell, we'll see a lot of these sort of abnormal shapes, okay? So why does that matter? So when these cells change into this shape, it makes it a lot harder to move through the small blood vessels of the body. And so those small blood vessels ultimately get blocked. And remember, the red blood cell's job is to bring oxygen to the organs and the muscles and the skin and all those tissues that need oxygen to do their jobs. And so when those organs and muscles don't get enough oxygen, they get injured. And when there's injury, the body's response is to say, oh, we got to help it, and send all these cells to help treat that injury. And that ultimately leads to inflammation. And then the other thing that's going on is not only are these cells getting stuck, but they're also getting damaged themselves. And those red blood cells ultimately get destroyed. And that's what leads to the anemia that we see in sickle cell patients. Okay.
Wow. So kind of that. So what you're saying here, that's kind of like, because I took trainings in other types of viruses and diseases before, and that deal with blood, and specifically around the T cell, the white cell, and that blood cell has a job of being like a defender of the body.
Yes.
It comes in and fights off, like the immune system fights off things. So you're saying the red cells are like the delivery system for the oxygen and all that kind of stuff, right? So if I can't get that blood where it needs to be at, because of many different reasons, because not just sickle cell, but I know I've had to have checked for my blood pressure. I had to check to make sure that I wasn't having any blocked arteries because of that and so forth. So okay, that's good. That's good to know.
Exactly.
Let's see. I got a question here from Rachel. She says, "What are the side effects of both?" She says, "I'm sorry if I noticed you already have said noticeable side effects, but I think she's asking about hemoglobin. I may have said it wrong."
So side effects of having low hemoglobin, you mean? Or what are the symptoms?
Rachel, you want to ask your question again in the chat, please do. But Santi says, "What are the side effects of both?"
Okay.
I'm thinking she's talking about the top where you're on right now. But she'll put the question back in the chat. She's good at doing that. She'll be right on that.
Okay, perfect.
Then we'll come back to the question. Side effects to sickle cell.
Oh, okay. So here we go. This is what I'm talking about. So I tell my families when these babies first come to my clinic, and then as we develop a relationship over years, what are the things we need to watch out for? And blood goes everywhere in the body, right? That's its job. So that means if we affect blood flow anywhere, it can potentially affect any organ in the body. And so not only are people with sickle cell anemic, but they are at risk for problems to other organs. And so it can be from head to toe. So people with the more severe forms of sickle cell are at risk for stroke. They're at risk for eye problems. They're at risk for lung and heart problems, liver, kidneys. There's an organ in the body called the spleen that is actually a really important part of the immune system, and that kind of gets affected first. And so babies are affected, and that's why it's so important for babies to be, one, diagnosed early, and two, come to see me, so that way I can help families protect them and know what to look out for. And then, the most common problem, and I'll talk more about some of these things that people with sickle cell undergo, is pain. So, if you like are leaning on your arm or something the wrong way and you cut off blood flow, you start to feel funny, right? And then you get up, and then the restoration of blood flow kind of makes that tingly, weird feeling. So imagine that happening on a much more intense level inside your body every day, all the time. And that kind of gives you the tip of the iceberg sense of what patients go through when they have these sort of pain episodes. So I'm not going to go over every single complication that happens with sickle cell because that would be way too long. But I wanted to focus on some of the really important ones and also the ones that we really can help with transfusion. And then we'll talk about transfusion. So I mentioned this spleen. So that is an organ in the left upper part of your belly that is really important in your immune system. It protects against certain type of bacteria. We call that bacteria group encapsulated bacteria. And some of the fancy names for those bacteria are Streptococcus pneumoniae, Haemophilus influenza. Those bacteria affect all of us and can cause ear infections, pneumonia, meningitis, bloodstream infections. And for all of us, we get immunizations during our infancy and some boosters when we're a little bit older. And then our immune system is primed to clear those bacteria because we've got a good working spleen. But people with sickle cell can imagine that blood flow doesn't really flow very well through the spleen, and then parts of the spleen dies. And this happens early on in infancy. And so babies are at high risk for these sort of infections. And in the 60s and 70s, before we really understood what was going on, one of the most important reasons for early death in sickle cell was from infection. And so, you know, babies and toddlers were dying from infection if they had sickle cell. And frankly, that is what goes on in areas around the world that don't have good screening techniques and you know, good access to vaccination. So how do we in America protect babies against this, this threat? So one, when we meet them in clinic, we start them on penicillin. So we put them on a preventive antibiotic twice a day until they are old enough where their immune system is mature and they've received all their vaccines. And then we can, you know, talk about stopping penicillin at that time. And then all those vaccines that they get throughout infancy are so important to help protect against these infections. And then they get some extra vaccines or early vaccines after 2 years of age. So that's something I want to emphasize. And now, because of all these advances from infectious disease perspective, we do not see kids dying from infection. Thank God.
Exactly.
All right. Yep. So what about pain? So again, I said this is the most common problem that people with sickle cell have, and it is really troublesome. And there are some triggers that you can identify. I've got lots of families who, you know, see, you know, when my kid does not drink enough water to kind of help with that blood flow. If they get dehydrated, that leads them into crisis. If they are playing outside in the snow for too long and they're not wearing a good jacket and hat and gloves, then they can get into pain. I've had some kids where, you know, they wanted to just have fun in the summer and they went swimming in a swimming pool, but they got chilled after they came out. And then they had to go to the ER with a pain episode that happened when they got chilled. Infections can lead to it. I've had some college students where they are under stress from finals and then they develop pain. In some girls, sometimes their menstrual cycle leads to it. And then other times we don't know, and it just sort of happens. I've had some families say that, like, when the weather changes, when it was like 70 degrees and then all of a sudden it drops, like, you know, in this area, this always happens, you start snowing. I do see some increased number of kids coming in with pain. And pain can start early. So I've seen some babies, you know, come in with painful, swollen hands and feet. And it is so hard, you know, for parents to see their baby, their sweet baby, you know, be suffering so much. And then, sometimes it's, enough to give him some Tylenol, Motrin, and some warm compresses, and then it gets better. But some kids need more intense treatment like IV pain medicine. And then as they grow older, it can affect other parts of the body. And sometimes the pain is mild enough they can manage at home, but sometimes they have to come into the hospital for prolonged IV pain medication. So it is tough.
I have a question from Casey in the chat. Says, does sickle cell disease / trait have something to do with heightened prenatal, postnatal, or death in some communities?
So sickle cell disease is certainly a risk factor for death in women if they are pregnant, and then at delivery and after delivery, they're at increased risk for clots, and they may be at increased risk for lung and heart problems. There is a question about whether trait makes you have increased risk as well. But again, there's just not enough research to know for sure about trait. But it is definitely considered a high-risk pregnancy if you have sickle cell disease.
Thank you. I hope that answered your question, Casey.
So the other thing, I wanted to talk about is stroke. So stroke can happen in people with the severe forms of sickle cell, meaning the SS form. And historically, before we had modern screening techniques, 10% of kids with SS disease would have a stroke before the age of 20. And that is incredibly high and devastating, because I think we all know somebody, or someone knows someone who knows someone who's had a stroke, and that affects people on so many levels. But this is a picture of a little girl who, when they go through it every year, they kind of get used to it, and it's not a big deal. But we use a special type of ultrasound machine to look at the blood flow through the arteries around their brain. And there are certain abnormalities that tell us if they are at higher risk for stroke. And if we identify that, then we start them on transfusions to prevent stroke. And so our numbers of stroke is far lower, but we still see it sometimes. So when stroke happens in people with sickle cell, it's like in other people, how it presents. I had a little girl, one of my favorite patients, who she had pain, but then her mom realized that she was still limping on that side, even though she was no longer in pain. And she realized that her child was weaker on that side. And we brought her to the emergency room, and we realized that she had a stroke. So lots of things happen to, make sure that stroke doesn't get bigger. But they can also present with slurred speech, or a seizure, or sudden loss of vision, or the worst headache that they've ever had in their life. These all could be a sign of stroke. Just like in older people with stroke, that's a reason to call 911. But in people with sickle cell, to treat a stroke, we do not use like clot busters. We have to do an aggressive form of blood transfusion to restore blood flow to the brain.
So basically, for stroke with related to sickle cell, you gotta, blood is very important. Having blood on hand is very important.
Very important, very important. Exactly. Okay, and one more problem that really is a big problem, and is actually the leading cause of death now in people with sickle cell, is something called acute chest syndrome. So this is an X-ray of the lungs, and I'll just orient you. So the lungs should be kind of nicely full of air, And on an X-ray, if it's full of air, then it's dark. And then these sort of whitish curves are the ribs. This white air thing in the middle is the heart. And then this structure down the middle is the spine. And we have 2 lungs, so it should look the same on both sides. But you see there's all this white stuff on this side, and that is full of sickled red blood cells. And it's not getting the air that it needs. And that's called acute chest syndrome. Okay. So as I said, it's the leading cause of death now in older patients with sickle cell. And it can happen because sickled cells are not flowing very well. It can also happen in the setting of pain, where, the bones, if they are affected by a crisis and that bone is injured, it can release sort of the bone marrow and the fat in the bone marrow, and that fat can travel to the lungs as well. And so it can lead to this sort of picture. And there are certain things that we do to treat it in the beginning, but if it's not responding to those treatments, blood transfusion is life-saving for acute chest syndrome. So that's another reason why transfusions are so important. And there are other treatments for sickle cell that can, one, decrease the rate of pain and really help keep organs healthy. There is a cure, bone marrow transplant, which I don't really have time to talk about, but it's not really appropriate for everybody. And there's something very exciting called gene therapy, where you can either correct or sort of replace the gene that is mutated, and that's still being studied. So there's lots of exciting things that I think can give hope to people with sickle cell. But I did want to focus on transfusions, since that was what we started the conversation about. Why do transfusions help? So remember, red blood cells are supposed to carry oxygen. And when you don't deliver oxygen to organs that need it, those organs get injured and ultimately can die. Transfusions also kind of dilute out the sickled cells and then help restore blood flow. And if we give it on a regular basis, we actually kind of suppress the body's production of those abnormal sickled red blood cells. And we talked about, the sort of illnesses that benefit from transfusions. There's, some people who can come in and become very, very sick where multiple organs fail. All of these things benefit from aggressive transfusion. But transfusions, they come from somebody else, right? So we're always, those are donated. And we match the major blood types of A, B, and O, but people don't realize that there are also other markers on the red blood cell called minor antigens that are also important to match. And the vast majority of donors in our community, and frankly in this country, are white. But we talked about how a lot of people with sickle cell are people of color. And we realized that when we look at these minor antigens, so the ABOs are the major antigen, but a minor antigen, for instance, it's called RH, and RH has different components to it. And there's some other minor antigens that we look at. These things may be different when you compare the white population and the Black population. And then that can lead to problems called a delayed hemolytic transfusion reaction. And I won't go through all the details, but a transfusion, which can be life-saving, if it's not appropriately matched, can ultimately lead to more harm. And there's a 6% mortality rate if this happens. So being able to match those minor antigens is absolutely critical. And that is why we need more donors who are people of color, so that we can more definitively match those minor antigens. And I think I'm going to stop sharing right now, so that way we don't run too much over and I can answer more questions.
Awesome. Thank you. I'm not on mute. Okay, great. Listen, that was very informative. I learned a lot here. We had some good questions. I think our audience got a lot of answers, a lot of questions answered. Giving blood. I want to focus on that for a minute, if I may, because I've heard in the past, I've heard all types of rumors, all types of stories, fables, and so forth when it comes to giving blood. Myself, I've been to prison. All right, and one of the things I've heard that is that if you've been to prison, if you've used recreational drugs, or if you've had an STD or something like that in the past, you can't give blood.
So that is not true. So one of the things that is really important is to make sure that you don't pass on any potential sort of infections. That is absolutely true when you donate your blood. But just because you went to prison, that really has nothing to do with it. And so if you are out of prison and you are generous enough to want to donate blood, and you know that you have not had infections, for instance, hepatitis B, hepatitis C, HIV, malaria, West Nile virus, some of these things we don't want to pass on in the blood. But if you haven't had any of those, then you are free and welcome to give blood.
Now, what if you've never been tested or checked for any other type of thing like that? You've been one of those people, because as we know, especially in the area of Black males, doctors, I don't know, I think we just got this issue with doctors. I'm starting to shake sitting here with you.
I'm not scary.
No, seriously, it's something about us and doctors where I'm not going to just stereotype and say it's a Black male issue, but really it's an issue that it stands out on because we have a lot more issues that we got to think about, and we don't go and get checked out. So what if there's some things going on and we haven't got checked out? Where should we start the process if we want to be one of those persons that give blood and in the future, and we want to we have some questions ourselves? What do you think we should start at?
Well, understanding that, not just Black men might be nervous about going to their doctor, but I think a lot of people are nervous about going to the doctor because they don't want to hear or look for bad news, right? But the issue is if you're going to be generous enough to donate blood to other people, you want to make sure that you are healthy enough to donate blood. That's number one. And you also want to make sure that your blood is healthy enough for other people. And so I would urge people to go to their doctor and really, get themselves checked out, make sure they're healthy. If they have had behaviors that maybe increase their risk for hepatitis B or C or HIV, that is something that's going to affect their health the longer they have it. And there are good treatments now that can help to keep you healthy. But if there is potentially a chance that you have these infections, I would urge you to go visit your doctor. And as doctors, we are not judging. We should not judge. We are here to help you. And we can test for these things and make sure that you're healthy.
Great. I have a question in the chat. Joanne has asked, what about those, and I think this is a very great question, what about those in the LGBTQ plus community? She says, I've heard tales of this population being screened out of donating blood. Is there truth to that?
So in the past, that was true, particularly for gay men. And that came from the years in the 1980s when there was a high rate of HIV among that population. But I believe that there has been a change in the policy of the Red Cross in accepting those donors. And, it's a long time coming because obviously, things like HIV are not limited to that population. HIV affects everybody. And so if you are healthy and you have not had that infection, then you are welcome to donate blood.
And encourage and encourage.
Yeah.
I would encourage you to. If you're healthy and you can, I would encourage you to give blood. I'm gonna give blood. I think it's important that we all do it. Let's see. Let's see. Joanne also said, I've heard of this in the last 2 years. Has the change happened recently?
I probably should confirm that, because I remember reading within the past year some communication that things have changed and people were kind of celebrating, but let's confirm that. And so yeah.
Great answer. We're gonna find out, Joanne. I'm gonna stay in contact, because I'm gonna be meeting several times because we're working on a few projects. So I'll keep asking that question for you.
Absolutely.
How about that? All right.
And speaking of donating, I donate every 3 months.
Every 3 months. Now here's the thing that caught me off guard one time, right? And when I was talking to Jim and Nina and others, when we go, how much blood do I have to, if I go to give blood? I've never given blood before now. I've never gave blood. I've never been to a place where they gave it at. I've never seen the process. Now I've seen things happening on TV, which I'm not sure what it was, but how much blood do I have to give? Do I have to go one of those little beakers? I mean, like when I go to the draw center and they pull blood to check my sugar and all that. Is that all the blood I got to give?
That's actually no. We actually give a lot more blood than that. We call it a pint of blood, but I think it's about like 250 milliliters of blood, and it's like in a bag that's this big. And it's actually, what we're giving is whole blood. And so they test that whole blood for any sort of infections, and then they separate it. They separate it into just the red blood cells, the platelets, and then something called plasma. And so those components are used separately.
Okay. So I give this blood. Typically in a draw event where you guys getting blood, how many of those things typically do you try to get? I mean, on a what is a good number?
So it depends on the goal of that drive at the time. They may target 25 pints of blood, all the way up to 50, 75. I know that we've got some ambitions to kind of collect 100 at some point in some major events. But it depends on where they are, what they're trying to do. But on average, it's probably about between 25 and 50 units.
So let me get this correct now. And I don't mean to laugh, but I'm thinking about our community as a whole here. And I'm like, wait a minute. One person gives about 1 pint. And that's like a unit. And you guys, when you do your draw times, you're excited if you can get 75 people to come and give blood.
That would be amazing. But these drives go on all the time throughout the area. So it's not like there's only 75 once a month, but there are, maybe 50 here on the west side and 50 here on the east side, and at the various high schools, and the hospitals themselves have blood drives. But we've had a shortage. COVID has really cut down on people being able or being willing to donate.
Yeah, now that's an area where honestly I didn't even really think about that until just now. Yeah, I can see that being we've been going through this for quite a while, and I mean, I'm at right now. I can imagine what you guys are going through with blood. I'm having a hard time getting dog food.
Oh my gosh. Yeah, you're absolutely right.
So I can only imagine what you guys are going through when people are not willing to come out, not willing to share, not willing to be social, interact with each other. I mean, giving blood, I think that's really personal right there. And COVID has had to have a big effect on that.
It has. And Yeah, and the Red Cross has done a good job, I think, protecting donors. So when I've gone, people are socially distanced. We're all wearing masks because we don't want our donors to get sick,
Hmm.
because then they won't donate again. So I hope people will feel more comfortable coming out.
So let's see, what do we got here? You might got any more questions here? All right, let's see. Let me ask this question, I guess. Is there a time where anyone who's watching or may watch a lot, who watching live now, may watch on the replay later, is there an event coming up anytime soon? I remember we're in Wayne County, and you're in Rochester, correct?
Yes.
So is there any events coming up in either Wayne or Wayne County or Monroe County anytime soon that you're aware of that you may want to put out there?
Yeah, absolutely. So there is an upcoming drive in Rochester on April 16th, specifically to help people with sickle cell, among others. And so there's a big push to get people to come out and donate on April 16th. But we've got other events that come up through the year, but that's the one that I know of coming up.
Do you have a location for that one? Do you know?
So that is at the Rochester Academy of Medicine. And maybe I can pull up the flyer and share my screen if my computer will move a little faster.
I've learned being live, don't push the computer too much on Zoom because it'll have you stuck with your mouth open for a couple minutes.
Oh, that's a good point. Oh, that's not a pretty sight for me anyway.
Be careful with that, boy, because that live will get you.
That's right. So let me try one more time. Because Deborah, our regional director for Red Cross.
If you can't find it, there's no biggie. If you find it, you send it to me an email. I'll post it. I'll share it, and I'll put it out here for everybody to see.
In Facebook, okay.
Yeah, I'll share it right on. I'll connect it to this here live for people to see. So hold me accountable. Yeah, I'm going to get this flyer out to you so we see when where this drive is going to be at, and maybe we can get out there. And to my friends who are in Monroe County, Rochester, watching, this is a sickle cell drive. This is something that's going to be specific and purposely, and it's going to have an effect on helping Black and brown people in this area. So let's get out and let's support. I mean, it don't take a whole lot of people. It really don't. It don't take a whole lot. If you come out there, if you got 5 people that you can think of, go hang out, go give some blood and go about your business.
And they give you snacks and drinks after.
and they give you snacks and drinks. Oh, come on, you can't get much better than that. So now, last thing, we're at our time here. So what I want to do now, Suzie, if people got questions for you personally, is there a way that they can contact you?
Absolutely. So I can put my email. That's probably the easiest way to reach me because, when people call, I always think it's spam, so I don't pick up anymore.
I hear that. It look like it's coming from down the road, but they're really trying to give you a new insurance for your car, or say, exactly. Hey, your warranty is about to expire. Do you want to renew it?
That is exactly. It's like, how many warranties do I have? My gosh. So so that's my email. Okay, in the chat.
Do you mind if I share that publicly?
I don't mind.
Okay, I'm going to put it in the chat on Facebook then right now.
Because I've dedicated my career to help people with sickle cell. And part of my way I do that is being a resource and educating people.
That's awesome. That is awesome. I mean, we need. Me personally, I think that if we had more people in the professional world that was willing to open themselves up and say, "Hey, listen, we're not in the time like we were yesterday. We're in a new time. Let's come together and let's make sure that this wealth of information that I have and resources that I have available can be used. I think our society can be in a whole much of a better place, and it doesn't hurt anyone's bottom line. I mean, if you're giving and people know you're giving, when people have to spend, they're going to come think of you a lot quicker.
Yeah, right,
Typically, we think that. So, I mean,
right.
if I'm looking for a doctor, and I
Mhm,
know I know that you're out and you're doing and you're giving, you're helping, and
mhm,
then I come across a situation where you fit. I'm gonna call. Even if it ain't, I'm gonna call you and be like, hey, Susie, listen, I got this situation. Who
mhm.
can you refer me to? At least that much.
Exactly. And
So
if
I think that'd be
right,
great if we have more of that.
right, because it's better to give good information and drown out the misinformation that I
Right.
see out there.
Great. Susie, I want to thank you. I want to thank you. I want to thank you 2-3 times if I can. This has been great. I've learned a lot. I've learned a lot.
Great.
Thank you so much for joining us. And Facebook, thank y'all for joining us. Thank y'all for your questions. Thank you for your comments.
Mhm.
Um, Next Monday. What am I doing Monday night? I got to let you know we're having our conversations. Susie, on Monday nights, we do a thing on Facebook where we like to demonstrate how we should be interacting with each other. So we have a segment called Old Heads Kicking It with Young Cats, and that's where myself and a couple of other elderly gentlemen, not elderly but older people.
Those are fighting words.
Couple gray heads, gray
Okay,
heads,
that's
a couple
better.
gray heads. We get together with some young people, and we have conversations about things that affect us in the community, and we demonstrate how we supposed to be communicating back and forth, how we can help each other, and we talk about real issues. This Monday night we're going to be talking about Black male disconnect. All
Mm.
right. Black male disconnect. And that's a serious issue that we disconnected from each other somehow. We need to figure out how that happened and start to reverse that process. So we're gonna be talking about Monday night, 7:15, only a half hour, 7:15 to 7:45. Join us. And next week, this show here is going to be live on location. I'm going to Albany this weekend for the Black and Puerto Rican Legislative Caucus, and I'm going to broadcast live from there next week. So I won't be here. I'll be in Albany. So join me, y'all. Until then, Susie, and Golisano's Children's Hospital and American Red Cross, thank you all. Thank you for coming and all the work you're doing. And let me get that flyer so I can get it out here.
All
Thank
right,
you
I will
all.
send it. Thank you so much, Mr. Schuler. This has been a wonderful opportunity, and I love
Great.
what you're doing.
Thank you. Facebook, we'll see you later. Facebook, have a good one. Peace.